Our correspondent, William EVANS-NKUM, is in the Ashanti region. He's joining us on Skype for some update of the situation in Obuasi and Ashanti region area. So, Evans, good afternoon. Thanks very much. I can see in your background a forest area. What's responsible for this backdrop?
Well, it has nothing to do, absolutely nothing to do with growing number of cases in the Obuasi. But it had everything to do with serenity. We needed a very good place so we can tell the Obuasi story very well. And Stephen, I can tell you that from what I'm getting from Obuasi at the moment, cases are growing beyond 600. We are still waiting for a confirmation. Latest in the next 2 or 3 hours, we should have a confirmation from the district health directorate. But I can tell you at least the sources that have been given us, one would say, unadulterated report as far as development on COVID-19 cases.
Right, William EVANS-NKUM, our man in Ashanti region, bringing us up to speed with. Yeah, so Mr. NKUM, I need to just start from the basics. Right now, we're being told by the Ghana Health Service that 272 of the cases come from Obuasi alone. And you are telling us that there is a likelihood that this could reach up to 600 from sources that you have spoken to. I want to find out whether these sources have given us a possible reason behind the rise in numbers in Obuasi.
It is a well-known, problem. Or one would say an impeccable error when the partial lockdown was announced. Remember, Obuasi was the first district to have recorded a case in the Ashanti region, but that place wasn't part of the partial lockdown. So it is assumed that people still had the disease, but because scientists have made us understand that some people may not be showing some level of signs, even though they may test positive, that is asymptomatic. Kind of people, that could have led to the widespread of the COVID and then the astronomical increasing of cases within the last couple of days. And it's something that maybe the official or the authority will have to come and explain why Obuasi wasn't part of the initial plan. Now, aside that, certain measures that the Kumasi Metro had put in place to curb or control the spread, Obuasi is now implementing those measures. One has to do with the closure of markets. It was only 3 days ago that the major market centers were closed. And now they are thinking of running a rotational system, a system that is in the books and, of course, is being implemented by the Kumasi Metro for about 3 weeks now. Obuasi, which is the epicenter in the Ashanti region, is now implementing those measures. So you could see clearly that there is so much lateness when it comes to tackling or showing some level of proactiveness in dealing with the cases or COVID-19 cases. Well, some of us don't want to believe that there was some level of, one would say, complacency. But from the figures that we are getting, I think it points to that direction, Stephen.
So Mr. NKUM, I also want to assess the levels of compliance with the safety protocols within Obuasi itself. You and I have spoken extensively about adherence to social distancing within Kumasi and Greater Kumasi and contiguous areas, etc. But what about Obuasi? You mentioned that because Obuasi was not part of the lockdown, possibly their behaviors in terms of adherence to these social distancing protocols have not been good enough. What's your assessment of these adherence to these protocols?
Now, something that the people in Kumasi and Greater Kumasi have learned over time, Obuasi is now going to learn that, and you should understand. Already, we are talking about a certain cultural construct that is making it very difficult for people to adhere to the social distancing protocol. Sometimes it's not about somebody trying to or deliberately not complying with this, but it's something that they've lived for a very long time. Kumasi or Ashanti is a traditional town, a traditional enclave. So people will want to shake hands and all of that just to show some level of respect and all of that. But that thing has been taken out of their everyday life because of the situation we find ourselves in at the moment. Inadvertently, Obuasi now will have to do that. And I can tell you, sometimes when you find people maybe forgetting themselves and doing what we've been asked not to do, sometimes you cannot blame them so much. I'm talking about Obuasi. It's because now they are now beginning to learn. In Kumasi, it has become part and parcel of life. It has become the new culture that people have adapted to. But Obuasi, it is something that they are now going to learn because they were not part of the original measures. So if you are asking what could have accounted for the increasing numbers of cases as far as Obuasi is concerned, you cannot mention any reason without leaving what I am telling you aside.
I can imagine. Now, you also earlier reported on the resistance from the residents in the use of a private facility as a holding center for people who have been infected with coronavirus. What updates can you give us on that?
Well, so the District Security Council, I'm talking about Obuasi East District, because Akapolisu falls under Obuasi East District. And then that of the COVID-19 team have stood resolute to ensure that that particular facility that was made available by a private developer is used or converted into an isolation center. Now, I can tell you that in the neighborhood, the people who were earlier protesting or agitating vehemently against the conversion are now, or more or less, living in an isolation. It's like a self-imposed restriction because nobody is coming out because of the fact that now they are beginning to understand that, quote unquote, they are strangers among them, and for that matter, they cannot. They cannot live with them. For some days now, they've been protesting against their coming into that particular enclave. But now they are there, but the residents who were earlier resisting their coming to that particular place are now indoors and they are not coming out for fear of contracting the disease.
Right. Ms. NKUM, we're grateful for your time. Thank you extremely for that report. William EVANS-NKUM is our reporter in Ashanti region, bringing us up to speed with the situation in Obuasi and surrounding areas, as well as this general situation in the Ashanti region.